Welcome back to special talk show on TVku. In the previous segment, we already talked about TB literacy research and how the limitation of elementary student and also community about knowledge and TB. And in this segment, we will talk more about how we handle the TB literacy, how to improve with Mrs. Eti. Maybe you can talk more about how does district public-private mix or DPPM help to manage or to control TB in Indonesia.
Okay, thank you. Yeah, this DPPM or district public-private mix. We did in Semarang. Semarang is a capital province of Central Java. It's a city in Central Java that also have a big number of TB cases. We know that DPPM started in early 2018. That will be implemented in 16 public health center in Semarang. The concept of DPPM is health service networking with involving government and private health facilities, professional and community organization under the leadership and coordination of the district health office. By three strategies were strengthening the leadership, regulation and budget allocation for TB prevention, partnership and involving of all health services between private and public health services, hospital and public health center, pharmacy, laboratory, private clinic and doctor, professional organization and community. Simultaneous intervention did in primary health care and secondary health care. From this chart, we can see that under leadership from head of a district health office from a team of DPPM, include inside is COPI TBC or TBC or Coalition of Professional Organization. Together, they fostering the primary and secondary health care. In primary health care level, public health center has main role to organize all health services that are laboratory, pharmacy, private clinic and doctor, also community. In secondary health care level, district health office doing coordination and fostering to private and public hospital. The steps for implementing DPPM begin with advocacy to the district health office to select several public health centers as target and have selected 16 out of 37 public health centers in Semarang. And then next, an induction meeting with 16 heads of public health center to socialize the DPPM program and arrange schedules. For the self-assessment, we ask the public health center to write down the national strategic activities and results they have done based on the instrument. To implement DPPM, we have facilitators, most of whom are doctors who have experience in TB program. They will facilitate the implementation of DPPM in public health center and hospitals.
Okay, Ms. Eti. I think the DPPM is very complicated, but yes, involve many stakeholders, right?
Yeah.
How about how your opinion about this, Mrs. Yani?
Yeah, actually, it is a good idea that have to do, especially in Semarang. But may I have one question? Like in Semarang, we have 37 primary health care, and it is still like 16 that developed to have this DPPM. How about the rest?
For the next health district offices, what means how many? Yeah? 18 public health center already implemented a DPPM program also. They're doing by themselves because we already finished the project from KNCV Foundation, and then the head office they're doing by themselves to facilitate DPPM implementation in 2023, 23 public health center.
Mm-hmm.
Yeah, 23 public health center. 23 public health center. 23
Mm-hmm.
So 37 of public health center already implemented TBPM program.
So it's already done by
Yes.
health office
Yes,
in Semarang.
already done,
I
yes.
think that's good. Maybe we talk about stakeholder, and I think there's a try to improve TB literacy, right?
Yes.
And compare with Miss Yani result, I think PPM still have a big challenge to
Yes,
to
of
that,
course.
right?
Yes, yes, yes. Of course.
Okay. Actually, I have a question to Miss Yani and also Miss Eti. How do you think what we should do to improve TB literacy in Indonesia from in the stakeholder option and from community option?
Maybe I can continue on the step of DPPM implementation. The key of DPPM implementation is in this activity, namely internal and external networking workshop. From this activity, everyone in each unit and health service has explored what they can do for the TB program, and they realize that they have an important role to play in eliminating TB in Semarang. Sign commitment as proof. And then developing SOPs for implementation is needed to ensure more structured flow. Form of a professional organization consisting of 16 professional organizations, both medical professional, clinics, laboratories, pharmacies, public health, and at community level, TB volunteers get workshop also to strengthening their capacity as a cadre, find suspect, and then refer to sputum and companion consumed by medicine. Monitoring and evaluation are the important thing to see the success of the program. So the district health office has a main role in this DPPM implementation, I think.
I heard some unique terminology. Cadre. What is cadre?
So there's a volunteer from community that they have not paying. They have motivated to help the patient of TB in medicine, and maybe they find suspect TB and then they refer the sputum to the public health center to diagnose this is a TB or not.
Okay. Now, about you, Miss Yani, your opinion about this?
So in my opinion, if we talk about community, I think the key is empowerment. Like we need to empowering the community that they have to do to prevent TB by themselves, and it's can like how to increase literacy. We need to have support not only from health side but also from the another side, like the education ministry or maybe social ministry and something like that, because I think TB is not only health problem, it is like what we can say, it's I think environment, which is not only health problem but also it can be better environment if another ministry like social ministry or maybe ministry, something like that, they have to empower the community together. So it can be done by ourselves as a public health, but it will be done if everyone is together as one to solve this problem.
Not only health sector.
Yeah.
For this program, I think.
Maybe Ms. Eti can give more emphasis about the strategic of government about TPPM to improve TB literacy in Indonesia.
Yes, actually, output of this TPPM implementation is a regional action plan that has signed by head of district, and then a rule agreement of each health services by memorandum of understand. It had from COPI TB, or Coalition of Professional Organization for TB Prevention, and active participation from community in tuberculosis prevention. And the impact of the PPM implementation, TPPM implementation, can be seen in the graph. In 1 year, the CDR increase was significant. The cumulative number exceeded the target. And in the CNR, our case notification rate chart also shows a significant increase. By looking at the good impact of TB program to maintain and get more impact, so that commitment, monitoring and evaluation must be the main activity to eliminate TB in Semarang or other district. I think that's a clue of the success of implementation of the PPM.
Okay, now we have to finish this discussion, even though it's very interesting. I think the final, both of you can make a simple conclusion how we can eliminate TB and how we can improve TB literacy in Indonesia.
Okay. To succeed eliminate TB, Indonesia we have planned 2030. It's need comprehensive strategy, comprehensive program, and that not involve only health sector but also non-health sector in they want to realize and contribute to eliminate TB in Indonesia, which is social and then environment and then law and housing sector. They have a main role also in this program to make sure that Indonesia will be eliminated in 2030, I think.
Thank you, Mrs. Esti. How about you, Ms. Yan?
Based on the research that we have done, I saw that there is need still empowerment for the community. Maybe we can apply it like communication for behavior impact about TBC that can empower all people, like elementary school, community, and like district, public-private mix work together to eliminate TB. Yeah.
Thank you, Mrs. Eti and Ms. Yani. This is end of our discussion. I think our discussion can get a bad benefit and give benefit to everyone. Thank you for watching with us. See you in the next AHLA seminar. And Assalamualaikum warahmatullahi wabarakatuh.